हेलो एभ्रिवान आजको यो भिडियोमा चाहिँ हामी फिमेल कम्युनिटी हेल्थ भलन्टियर्सको बारेमा हेर्छौँ एफसीएचभीस को बारेमा के छ कहिलेदेखि यो प्रोग्राम स्ट्याब्लिश भयो अनि वुमेनहरु मात्रै हुने हो कि फिमेल कम्युनिटी हेल्थ भलन्टियर्समा मेल पनि हुन्छन् भन्ने कुरा क्वेशन्सहरु पनि हुन सक्छ त नामै फिमेल छ अनि के होला क्राइटेरिया भन्ने क्राइटेरिया के होला भनेर पनि थाहा हुन मन छ होला त्यही भएर यो भिडियो हेर्नु भएको होला सो फिमेल कम्युनिटी हेल्थ भलन्टियर्स चाहिँ यो प्रोग्राम 2045-46 PS अथवा 1998 मा लन्च भएको प्रोग्राम हो यो बेसिकली चाहिँ नेपालको कन्टेक्स्टमा म्याटर्नल एन्ड न्यूनेटल डेथ चाहिँ एकदम धेरै थियो त्यसलाई मोबिलाइज गर्नको लागि त्यसलाई आई मिन मोबिलाइज एज इन कम्युनिटी रिसोर्सेस मोबिलाइज गर्नको लागि पार्टिसिपेसन मोबिलाइज गर्नको लागि आएको प्रोग्राम हो यसमा चाहिँ कम्युनिटी पार्टिसिपेसन द्वारा आफू नेशनल गोल्स हरुलाई सपोर्ट हुने तरिकाले आफै नै आफ्नो कम्युनिटीको हेल्थ प्रति रेस्पोन्सिबल हौ भन्ने सेन्सले आको यो फिमेल कम्युनिटी हेल्थ भलन्टियर प्रोग्राम हो र यसमा चाहिँ यो चाहिँ एउटा लिंक जस्तो हो के भन्नाले यो प्रोग्राम चाहिँ हेल्थ फिमेल कम्युनिटी हेल्थ भलन्टियर्स चाहिँ नेशनको गोल्स र अनि त्यसपछि कम्युनिटी बीच चाहिँ एउटा ब्रिज जस्तो काम गरिरहेको हुन्छ फिमेल कम्युनिटी हेल्थ भलन्टियर्सहरुले नेशनल गोल्सहरुलाई सपोर्ट गर्ने रिसोर्सेसहरु मोबिलाइज गर्ने कम्युनिटी पार्टनरशिप हुने यो चाहिँ सबै फिमेल कम्युनिटी हेल्थ भलन्टियर्समा हुन्छ र फिमेल कम्युनिटी हेल्थ भलन्टियर्सहरु को चाहिँ आफ्नै पब्लिकेशन्स यो सबै भलन्टियरली अप्रोचमा उहाँहरुले काम गर्नु भएको हुन्छ कति पनि पैसा पाउनु हुँदैन इयरली इन्सेन्टिभ एज इन ट्राभल इन्सेन्टिभ चाहिँ म्याक्सिमम भयो भने 10,000 हुन्छ अनि उहाँहरुको क्यापासिटी बिल्डिङ ट्रेनिङ हुन्छ अनि त्यसपछि बेसिक ट्रेनिङहरु पनि भएको हुन्छ सुरुमा इनिशियली इनरोल हुने बेलामा बेसिक ट्रेनिङ र बीचमा चाहिँ क्यापासिटी बिल्डिङ ट्रेनिङ हुन्छ इयरली 2 वर्षमा 2 चोटी चाहिँ रिभ्यू मिटिङ हुन्छ यो फिस्कल इयरमा के भयो भनेर थाहा पाउनको लागि चाहिँ इयरली रिभ्यू हुन्छ है त अब फिमेल कम्युनिटी हेल्थ भलन्टियर द नेशनल फिमेल कम्युनिटी female volunteer program was introduced in 1988 अथवा 2045-46 under the Public Health Division of Ministry of Health. Initially, female community health volunteer was started in 27 districts. By 1995, the program expanded in all 75 districts. Female community health volunteer established for assisting primary healthcare activities and acting as a bridge between मैले अघि भने नि bridge जसरी उ भनेर यसलाई यो एकदम सम्झिनु पर्ने शब्द हो they act as a bridge between governmental health policy and community, governmental health services and community. So government health services र community को बीच से they act as a bridge. Initially, the approach was to select one female community health worker per one VDC regardless of the population size. Later in 1993, population-based approach was introduced in selected 28 districts. At present, 52,000 female community health volunteers are working all over the country. So 52,000 FCHVs are all over the country work गरिरहनु भएको छ पहिला चाहिँ एउटा female community health volunteer would be assigned to each VDC तर अहिले चाहिँ के छ भन्दाखेरि 1000 population लाई कभर गर्नको लागि चाहिँ एउटा female community health volunteer हुनुहुन्छ तराई रिजनमा त्यसपछि 600 population लाई कभर गर्नको लागि चाहिँ एउटा female community health worker हुनुहुन्छ हिल्ली रिजनमा र हिमालयन रिजनमा चाहिँ 150 population लाई कभर गर्नको लागि चाहिँ एकजना female community health volunteer हुनुहुन्छ So, the National Female Community Health Volunteer Program was introduced in 1988 अथवा 2045-46 under the Public Health Division of Ministry of Health. Initially, female community health volunteer was started in 27 districts. By 1995, the program was expanded in all 75 districts. Female community health volunteer program is established by assisting primary healthcare activities and acting as a bridge between the governmental health services and the community people. Initially, the approach was to select one FCHV per VTC regardless of the population size. Later in 1993, the population-based approach was introduced in selected 28 districts. At present, 52,000 female community health volunteers are working all over the country. A major role of female community health volunteer is to promote health and healthy behavior of mother and community people for the promotion of safe motherhood, child health, family planning, and other basic services to support the um, health professional from health post and primary health care. अब गोल भनेको चाहिँ नेसनल गोललाई नै सपोर्ट गर्ने हो चाहिँ छ यसको goal चाहिँ the goal of female community health volunteer program is to support the national goal on health through community involvement in public health activities through imparting knowledge and skills for empowerment of women and raising awareness on health related issues and involvement of local health institution. So यसमा अलि धेरै कुराहरू पनि छन् जुन सम्झिन पर्ने छ जुन चाहिँ सपोर्ट नेशनल गोललाई सपोर्ट गर्ने हो पहिलो कुरा चाहिँ सपोर्ट द नेशनल गोल अफ द कन्ट्री थ्रु कम्युनिटी इन्भल्भमेन्ट यो दुईटा चाहिँ हुनु पर्यो नेशनल गोल र कम्युनिटी इन्भल्भमेन्ट हुनु पर्यो त्यसपछि इम्पार्टिङ नलेज एन्ड स्किल्स फर इम्पावरमेन्ट अफ वुमन त्यसपछि वुमन इम्पावरमेन्ट सम्झिन पर्यो इम्पार्टिङ knowledge skills for empowerment of women and increasing awareness on health related issues about women empowerment health related issues ma awareness and involvement of local institution in providing healthcare objective भनेको to activate women in tackling health problems to prepare a pool of self motivated volunteer as a focal person for bridging the health programs with community, to prepare a pool of volunteers to provide services for the community based health programs, to increase the participation of community in increasing health workers, to develop female community health volunteer as a motivator of health. So female community health volunteer to develop female community health to activate them हैन पहिला सुरुमा activate women to tackle the health problem to develop FCHB as the motivator of health त्यसपछि एउटा pool create गर्ने अनि pool create गर्ने for self motivated volunteers as a focal person for bridging the health programs increasing participation of the community in improving health. अब सिलेक्सन अफ एफसीएचपी मा चाहिँ के क्राइटेरियाजहरु छन् एकचोटी फेरि रिभाइज गरौँला यो गोल चाहिँ किनभने यो राइट द गोल्स भनेर स्पेसिफिकली नै मेन्सन गरेको हुन्छ सो गोल भनेको चाहिँ नेशनल गोललाई सपोर्ट गर्ने थ्रु कम्युनिटी इम्पावरमेन्ट अनि यसमा चाहिँ नलेज इम्पार्टिङ नलेज एन्ड स्किल्स फर वुमन इम्पावरमेन्ट एन्ड इन्क्रिजिङ अवेरनेस अन हेल्थ रिलेटेड इश्यूज अब हेल्थ रिलेटेड इश्यूजहरुमा अवेरनेस दिने and involvement of local institution in promoting healthcare अब objective मा चाहिँ activate women for tackling health problems त्यसपछि create a pool of self motivated volunteers as a focal person for bridging the health program with community increasing the community participation in the community develop FCHB as a motivator अब selection of FCHB मा चाहिँ के छन् criteria भन्दाखेरि women चाहिँ 25 देखि वुमेन चाहिँ 25 देखि 45 इयर्स को हुन पर्यो एउटा कम्युनिटीको लोकल रेसिडेन्ट हुन पर्यो अथवा लोकल एजेन्ट पर्मानेन्ट रेसिडेन्ट हुन पर्यो र उसले चाहिँ एटलिस्ट मिनिमम एसएलसी पास गरेको भए चाहिँ अझ धेरै प्रेफरेन्स दिइन्छ अझ धेरै प्रेफरेन्स दलित कम्युनिटीको वुमनलाई जनजातिलाई दिइन्छ a meeting of mothers group for health will select FCHP on the following basis. The decision of the selection of the new FCHP should be communicated formally to the local health institution and local government. Based on the selection of FCHP, permanent resident of the related community लाई priority दिइन्छ त्यो ठाउँमा बस्ने permanent resident of the local community willing to work as a volunteer for at least 5 years को commitment हुन पर्छ at least 5 years and age between 25 to 45 years priority will be given to married women commitment to serve the community should have completed class 10 however in mountain and remote region women who have completed basic education can also be selected priority will be given to women from Dalit Janjati and marginalized group they should not have paid job हुन भएन and त्यसपछि should not involve in political activities and should not be an elected member they should not be involved in कुनै पनि political activity मा चाहिँ involve हुन भएन should not be involved in political activities and should not be an elected member सो फेरि रिभाइज गर्न पर्दाखेरि चाहिँ एटलिस्ट 5 इयर्सको कमिटमेन्ट हुनु पर्यो 25 to 45 इयर्सको हुनु पर्यो त्यसपछि प्रायोरिटी म्यारिड वुमनलाई अझै प्रायोरिटी दिइन्छ कमिटमेन्ट हुनु पर्यो should have completed at least 10 बेसिक एजुकेसन हुनु पर्यो र दलित जनजाति मार्जिनलाइज कम्युनिटीलाई चाहिँ अझ धेरै प्रिफरेन्स दिइन्छ पेड जब हुन भएन पोलिटिकल एक्टिभिटिजमा इन्भल्भ भएको हुन भएन र इलेक्टेड मेम्बर पनि हुन भएन one FCHP will be selected for 1000 population in Tarai 600 in hilly region and per 150 population in mountain however the number of FCHP can be adjusted by the concerned government by their own additional cost अब दुईटा खालको ट्रेनिङ दिइन्छ एउटा बेसिक ट्रेनिङ will be provided to all the newly recruited FCHP and capacity building training will be capacity development activities of FCHP will be carried out through training refresher training and orientation program as per the new program अब role of FCHP भनेको यो हेल्थ पहिला चाहिँ आफू एक्टिभेट भएर एउटा पुल अफ भलिन्टियर्स क्रिएट गर्न पर्यो एउटा मोटिभेटरको रूपमा एक्ट गर्न पर्यो अनि त्यसबाहेक अरू भनेको चाहिँ काउन्सिलिङहरुमा हेल्थ एजुकेसनमा एक्टिभली रोल प्ले गर्न पर्यो अझ बेसिकली फ्यामिली प्लानिङ रिप्रोडक्टिभ हेल्थ maternal and child हेल्थमा चाहिँ अझ धेरै इम्फोसिस दिन पर्यो द मेन रोल अफ FCHP will be concentrated on health promotional activities of mother and children अब मैले भनेको थिएँ त्यही नै छ mothers यही नै The main role of FCHP will be concentrated on health promotional activities of will be concentrated on health promotional activities of mother and children in their working area. They will also provide help in promoting the utilization of available resources, utilization available resources, and raise awareness on health through MGH भनेको mothers group. त्यसपछि FCHP will help various health programs such as family planning, safer motherhood, newborn care, immunization services, communicable and non-communicable diseases, acute respiratory diseases, diarrheal disease control, environmental sanitation, health education, and other national programs. FCHP will also provide recommended services like drug distribution and disease management as directed by the Nepal government through community-based approach. Other health programs might involve FCHP through their guidelines. However, the involvement of FCHP in other programs should be mandatorily endorsed by the central FCHP coordination committee. FCHP have to write an annual report. Annual report चाहिँ लेख्न पर्ने हुन्छ to local health institution and her mother group for health. त्यसपछि FCHP have to submit a monthly report of her activities to local health workers or the supervisors. So every month पनि लेख्न पर्यो त्यसपछि monthly report every month पनि लेख्न पर्यो yearly annual report पनि बनाउन पर्यो FCHP can be selected by her respective mothers group for the term of 5 years. FCHP are entitled to abide by the code of ethics developed for them. About tenure of FCHP भनेको चाहिँ FCHP can work as FCHP up to the age of 60 if the MGH अथवा mothers group recommend for the continuation of her work every 5 years. Role of health workers health workers working in the primary healthcare institutions such as auxiliary health worker, auxiliary nurse midwife, staff nurse, health assistant or in charge of local health institution will help the work of FCHP and MGS including the supply of recruited drugs and materials collection of reports from FCHP and conducted meetings and providing technical support. अब retirement चाहिँ FCHP चाहिँ 60 years भइसकेपछि retirement हुन्छ FCHB attaining the age of 60 years will be bidden farewell on the recommendation of mothers group. A letter of honor as well as designated amount may be provided to retiring female community health volunteer after serving satisfactorily for the period of years. Retiring female community health volunteer will be requested to be the honor member of the mothers group. Retiring female community health volunteer might continue to get benefits like obtaining free essential healthcare services. So they will continue to get free essential healthcare services. Retired FCHPs also get free essential health services. Any review of FCHB, review meeting of FCHB, all the primary healthcare level in health institution will hold review meeting of FCHB 2 times a year, preferably in the gap of 6 months, November or July months, with the duration of 2 days. The meeting will review the performance of FCHB and plan for the future activities. The primary healthcare level मा all the primary healthcare level institution. So the in charge of local health institution will conduct the review meeting of FCHBs. The in charge of local health institution will conduct the review meetings of FCHBs, will be participating in the review. During the review meeting, the review of FCHB and relevant health programs will be carried out. Besides analysis of ward register, problem identification, solution, recording of vital events such as maternal death, neonatal death, couples using family planning methods will also be done during the review. Necessary guides and logistic support will also be provided to FCHB during the review meeting. During the review meeting of the activities related to FCHB, fund mobilization and utilization, as well as discussion on raising the funds, will also be done. In the in charge of local health institution might invite representatives from local government as well as ward members and members of other health facility management committee. अब additional activities भनेको publication of उनीहरूको आफ्नै magazine हुन्छ, FCHB magazine हुन्छ called हाम्रो कुरा, FCHB fund establishment हुन्छ, FCHB survey हुन्छ, birth preparedness package, radio program, electronic FCHB database. So के हुन्छ भन्दाखेरि FCHB को magazine हुन्छ, publication of FCHB magazine हुन्छ हाम्रो कुरा भन्ने, establishment of FCHB fund, FCHB survey, electronic FCHB database, birth preparedness package, radio program. अनि strength भनेको चाहिँ यो high priority program हो, regular government program हो. त्यसले गर्दाखेरि चाहिँ maternal and neonatal deathsहरू decrease भएको छ. Community participation पनि हुन्छ, community mobilization हुन्छ, resource well utilization हुन्छ, direct contribution to the improvement of maternal child health, improve effective community mobilization, identified and effectively treated pneumonia by FCHB. So pneumonia पनि effectively treat हुन्छ. त्यसपछि support the distant learning program of FCHB through mass media or by radio in particular, regular training and review meetings, celebration of FCHB days. अब यसमा चाहिँ उनीहरुमा high expectation पनि हुन्छ है कम्युनिटीबाट, तर उहाँहरुले चाहिँ धेरै हेल्थ सर्भिसेसहरु प्रोवाइड गर्न सक्नुहुन्न. उहाँहरु चाहिँ बेसिकली हेल्थ एजुकेसन काउन्सिलिङ अनि त्यसपछि निमोनियाको ट्रिटमेन्ट अनि फ्यामिली प्लानिङको काउन्सिलिङ अनि फ्यामिली प्लानिङ मेथड्सहरु डिस्ट्रिब्युसन जो जनरल मात्रै हुन्छ. अब धेरै हाई एक्सपेक्टेसन पनि हुन्छ उहाँहरुबाट. अनि ल्याक अफ बेसिक ट्रेनिङ टु न्यूली अपॉइंटेड, बेसिक ट्रेनिङ्सहरु प्रपरली दिएको हुँदैन. ल्याक अफ बेसिक ट्रेनिङ्स टु न्यूली अपॉइंटेड, न्यूली सेलेक्टेड FCHB, lack of an irregular and under supply of commodities to FCHB, lack of support to FCHB, lack of monitoring and supervision, lack of incentives. अब पैसा पनि दिएको हुँदैन, उनीहरुलाई ट्रेनिङ पनि राम्रो भएको हुँदैन. अनि irregular and under supply of commodities, lack of support, monitoring नि हुँदैन, basic training पनि हुँदैन. अब opportunities भनेको चाहिँ bilateral यो प्रोग्रामलाई चाहिँ bilateral र multilateral partnersहरूले support गर्छन्. Many women are willing to be FCHB. Training to FCHBs on CBIM and CI. Training of FCHB on CBIM and CI, CB, MCP, RBP, etc. Provision of FCHB fund by government, decentralization and delegation of authority management of local government. अब threatsहरु भनेको चाहिँ थ्रेट्सहरु भनेको चाहिँ यो female community health workers को चाहिँ high program demand for community based interventions. त्यही भएर उहाँहरुलाई चाहिँ उहाँहरुको वर्कलोड अलि धेरै हुन्छ. Aging of FCHB, illiteracy among FCHB, threat to voluntarism, voluntarily withdrawal भनेको काम नगरिदिने, bargaining of FCHB for financial incentives, पैसा दिनु भनेर जुन यो त फ्री भलन्टियरिङ गर्ने हो नि त, त्यसमा पनि पैसाहरु लिने हुन्छ, माग्ने हुन्छ. त्यो जुन चाहिँ it is not nice नाउ हामीले सेलेक्सन पनि हेऱ्यौँ सबै अनि बेसिक ट्रेनिङ र क्यापासिटी बिल्डिङ ट्रेनिङ आई थिङ्क यति नै छ यसमा चाहिँ फिमेल कम्युनिटी हेल्थ भलिन्टियर्समा थ्याङ्क यू सो मच